Welcome to the Diva D-Town. Welcome to the Diva D-Town, where bold, confident women embrace life unapologetically. From love and sex to wellness and reinvention, we keep it raw, real, and powerful. No filters, no limits. Just fearless conversations to help you thrive. Let's dive in with Diva Mia.
Hello, this is Diva Mia. Today we're going to talk about getting turned on. I know it's a little faux pas for some people, but there's a point in midlife where a lot of women look around and they think, wait, where did my turn-on go? And your turn-on is a little bit different than your libido. It's something that, does sex feel spontaneous or does it feel rehearsed? Is it getting boring? And there's certain things that may excite you that you didn't know before, and there's certain things that may turn you off that you used to like. So we're going to talk about it a little bit. And sometimes when you get older, you may think about sex more often. There's something that happens to women as our kids go away to college and we get more freedom in our lives, that things sometimes we're more turned on than we were before. Sometimes your body responds faster, so orgasms come easier. And you could be folding the laundry and all of a sudden feel sexy and want a massage by your boyfriend and you don't have to have the perfect lighting, but all of a sudden you have turn on again. It's a little bit different than libido though. And then somewhere in your 40s or 50s beyond, things change. Sometimes it's more pleasurable, sometimes it's less. It depends on the person, but let's talk about it and ways to combat it if you're having issues. Because losing some of your sexual responsiveness in midlife, it does not automatically mean you've lost your sexuality. Sometimes it's just a hormonal thing like we've talked about in the past. Sometimes, your hormones have changed. Sometimes the relationship has changed because for women, for us, we really need to have that emotional and mental connection. Sometimes your brain is overloaded with work and too much stress, and therefore your turn on is turned off. And sometimes you simply been doing the same thing for 20 years, the exact same thing, the same positions, the same person, the same way, and you need to rewrite the manual and maybe review it with your partner and say, look, let's figure out something else, not just let's add lubricant. Let's figure out something that turns me on and turns you on that we can experiment with and play with. When you have hormonal and vaginal issues and maybe erectile issues with your partner, there are things that you can do to help with the issues. There's something called an O shot for women. And the O shot makes it so women have more blood flow down there. Their orgasms may be much greater. And it's a way to get everything working a little bit more. What they do is I've actually had it done. So they spin your blood down. And it's a PRP procedure. What they inject internally into your G-spot and into your clitoris. That's what the O-shot is. For me, it was a vaginal dryness thing that I was trying to overcome, but there are added benefits. It actually increases blood flow. Now, it's not a permanent thing. It's something you would have to do more than once. But there's other things you can do too, like certain devices, toys, vibrators, pelvic floor therapy. There's a pelvic floor therapy that you can do now to help tighten the area if you need it. Because a lot of women, their pelvic floor has gotten a little loose, or it's starting to drop, or things are changing inside. Then there's, you need to explore your body and find out exactly what you need. Maybe, you and your partner once a week have just like an exploration sexcapade where the kids are gone, if you still have kids around, and you just figure out what you both like and explore each other's bodies. The psychological effect of becoming that sexual person again will overrule any insecurities. If you can have fun and explore each other's bodies and play, that's a great way to be instead of doing the same thing over and over again. We're going to talk about things that people don't always talk about at brunch. That's okay. That's what this podcast is for. The stuff that embarrasses most people, this is the stuff I like to talk about. First, we have to separate desire and arousal. So desire is whether I want sexual activity. Arousal is the body's response to it. So if you're getting sexually stimulated, is your body getting excited? When your partner comes up to you, do you get excited when they touch you, or has that turned off as well? Orgasms is a separate process. Orgasms is different than getting turned on. You may not be completely sexually aroused, but when you start the act of sex, the orgasms may come. You can have one without having the others. It becomes particularly important during and after menopause because many women stop experiencing the kind of spontaneous desire they remember from earlier life. Now, I personally have not gone through that, But I know that some people complain that the desire for sex is less. Instead, they experience what's called responsive desire. You may not be sitting on the couch thinking, I desperately want to have sex with you, or you might, who knows, it depends on how you are. But what happens is while you're touching and kissing and other types of cues, that's when you get desire. It's like an internal thing that just comes when you have some type of action, whether it's kissing or cuddling or touching, and your brain says, I could do it right now. That's what's called responsive desire. This distinction can completely change how you think about your libido. It may be that you just need more quality time with your partner. If you're waiting around for spontaneous desire to strike, you're like lightning. You may be waiting a while. What you need to do is maybe introduce some playtime with your partner or spend more time cuddling and touching and kissing. This can give you more desire for them and lead to more of a responsive desire. Sometimes you have to create the conditions that allow desire to show up. Your body needs more of a runway now. Our bodies need more time. We need more stimulation. For women, our estrogen, as it declines, we may have vaginal tissue issues, lubrication. Sometimes it hurts. You may get an elasticity problem or a blood flow problem. Testosterone and other hormones changes can also affect your sexual desires. Your testosterone is down, which we talked about a couple podcasts ago. That may affect your sexual desire. And men, they have it worse than we do, ladies, sometimes with sexual desire, because sometimes they can't even get an erection. It may be slower or less predictable, and then they have a psychological break when they can't perform. It's very stressful for a man. Remember, if you're with a partner that's having performance issues, give them some grace and help them through it, because a lot of times it's a mental thing and a mental block as well. If they're not healthy cardiovascular-wise or they're not on testosterone, it could be a problem. Some of the medications they may be on, or they might have stress or drink too much or, not enough sleep, and those things can also lead to performance issues for men. They have a tough time with this as well. This is where couples make a huge mistake together, is they think that everything should be the same, and it's not. Some men think if it takes you longer to have an orgasm, that you're less attracted to them or you lack attraction to them. If it takes a man longer to get turned on, sometimes you think, what am I not getting? What am I not doing to turn him on? Then a woman may think, why am I not turned on by my partner anymore? Then he thinks, why is my erection not as immediate as it used to be? There's things that men go through and women go through psychologically, but you guys should talk them out because you're just older. It's okay. If there's performance issues once in a while, it's okay. But keep trying. I mean, sex should be fun into your 70s, 80s, and beyond. They always say the 50s, the new 30s. So I think that, as we get older, we are having as much sex, if not more, than we were when we were younger. Both people sometimes can get self-conscious too. If there's a sexual issue, both people may be self-conscious. So talk it out, because nothing kills arousal quite like turning sex into a performance review and analyzing each other and making complaints and being mean. I mean, you're going to really kill the sex libido if there's not softness and grace. The best approach is to recognize that your body is simply no longer a runway. You need a little bit of warming up. You need more anticipation, flirting, touching. Some mental stimulation for ladies goes a long way. And ladies, we don't like it the same way every time. Just so you know, a little bit of novelty or newness. Otherwise, it feels like pressure to perform. And we like a little bit of, mental stimulation as well as novelty. And I will say, when men are touching women during the day and flirting with them and holding hands and smacking them in the butt, maybe if they like that, those types of things will, lead to better sex at night as well. Here's something I want everyone to listen to. Instead of asking yourself, why don't I want sex? Ask, what makes me want sex? What specifically makes you want to have sex with someone? Those are two completely different questions. So think about the last several times you generally felt sexy. What happened? Were you relaxed? Were you dressed up? Did you feel attractive? Were you on vacation? Had you just come from exercising? Were you laughing together? I mean, sometimes you need to relive the steps that made you feel very sexy. Were you emotionally intimate? Were you flirting with someone? Or were you flirting with him? Was he flirting back with you? Were the children gone? Because I know for me, having the children around is a very difficult time to have sex because you have to be quiet, and being quiet is not really my forte. So having children around or laundry to do or other responsibilities can decrease your desire cues. Your job is to learn exactly where you need to be in your headspace in order to get turned on, because your brain is part of your sexual organ, and you can intentionally create more of those conditions if you understand what is exactly working and what not working for you. The brain is your biggest sex organ. When we tend to talk about libido as though it's entirely hormonal, it's not. Your brain matters enormously. Stress is the perfect example. If your nervous system is thinking, I have 42 emails to file, I have the kids need something, I have to go pick them up, I have a meeting tomorrow, the house is a mess, I don't feel good about my body. Then suddenly somebody says, want to have sex? Your brain's like, are you kidding me? That's not necessarily sexual dysfunction. That's cognitive overload. You need transitions. You need to take a shower, put away the phone, maybe have some quiet time, change your clothes, play some music, dim the lights, and have a conversation. There needs to be some type of ritual. I told you before on one of the podcasts that I used to light a candle if I was in the mood and wanted sex that night, or he would, and that way we know we need to unwind, relax, and then it opens up the door for sex. Once the workday is over, pleasure is allowed now. So figure out what steps you need to take in order to have that pleasure. And then reconnect with your body. Now let's talk about something that still makes some women uncomfortable. It's solo sexual exploration. I'm not talking about replacing your partner. I'm talking about understanding your own body. And your body at 50, 51, 52 is not the same, or even 60 is not the same as it was in 22. That's important information. Explore what pressures, what vibration, what touch, different fantasies, temperatures, and pace you like. You may not want to be pounded like you were in your 20s. You may want to have it slower. You may want to have different positions. You may want to have toys introduced. Women sometimes expect their partner to figure out something they haven't figured out themselves, which is kind of not couth. That's a difficult assignment. Solo exploration removes performance pressure for men. So if you say, I like this and I don't like this, then they understand because there's no clock. There's nobody waiting for you to orgasm. There's no concern about whether someone else is enjoying themselves because you know exactly what it will take to enjoy yourself. You can keep learning. When you solo explore, you have as much time as you want. Once you know, you can then communicate it to your partner. It's incredibly valuable to know what you enjoy. And toys aren't competition to the men. Just realize there are toys and vibrators out there that work with both men and women. There's clitoral stimulators that are also used during intercourse that can also be used as stimulation for men. So it's not a relationship failure. It actually adds a lot of fun to a relationship. There's also erection rings and vacuum erection devices for men to help them along their way. The object isn't to buy a drawer full of gadgets and hope one magically fixes your relationship. The objective is to say, what would make our sexual activity easier, more comfortable, more interesting, and pleasurable for both of us. Sometimes technology helps. It's a wonderful day in the world when we can have technology help us in sexual areas as well. We use technology in every other area of our life. We might as well use it in the bedroom as well. Try a toy. Let's talk about lubrication and moisturization, or moisturizers for women. The distinction matters because lubrication is generally used during sex, and it's used for friction. Moisturizer is regular, and it helps maintain moisture and comfort. A lot of women experience vaginal dryness. So if penetration hurts, it may very well be that you're just dry down there. And pain is information. There are different syndromes related to dryness or pelvic floor dysfunction. Could also be a bacterial infection you have to worry about. And you could also need to talk to your doctor. So you know what's going on. Vaginal estrogen and other menopause treatments are great if you have dryness because low-dose vaginal estrogen, which I'm on, it improves dryness greatly. It's just great for the tissue in general. And I've had no problem since I'm on it. And I can honestly say I'm not really regular. I probably take it every couple days instead of daily, but it's good enough. And there are other prescriptions, including vaginal DHEA and oral things for patients to take to help with dryness. Systemic menopausal hormones therapy may help you as well if you're depending on your symptoms and your history. But testosterone is increasingly discussed in women's sexual medicine. Evidence is being shown that testosterone prescribed at the right level for postmenopausal women, it helps with sexual desire disorder and muscle mass, and brain fog goes away and can even help with hot flashes. This is an area individuals' dosing and monitoring matters. The more testosterone is not automatically going to lead to bigger libido. That's what a lot of women don't realize. You're not going to turn into a sex machine just because you have a little bit of testosterone. It's not like it's the volume knob and you keep turning it up until you turn into a sexual person. It can help, but you still need to work the other areas. The O shot, which I talked about a little bit earlier, is a procedure which is getting platelet-rich plasma. So they take your blood out and they spin it down and they inject it into other areas like the clitoris and the vagina. And then they use components derived from your own blood, which is the PRP. It does increase sensitivity. The lubrication is definitely better, and it may help your orgasms or sexual function. It depends on each person. But the important part is that you need to find what works for you. And it doesn't mean that this will work for you, but you might want to try it. You'd have to talk to your doctor, and they have different places where you can find it. And it's not going to suddenly turn you back into a 20-year-old. I say, though, my orgasms are better in my 50s than they were in my 20s because I really think I'm more mentally connected than I used to be to my body. And when I'm more mentally connected and I know myself, I'm able to understand what turns me on and what doesn't, what angle, what position, etc. Men have several completely different categories here too. So they have what's called a P shot, and it's a penis shot. It's an injection into their penis. So guys are probably like, ooh, but it helps with erectile tissue issues. I've never seen anyone do this, so I can't specifically speak to it, but the medication, it can help with the erections and increasing blood flow. This is another thing that men need to talk to if they're having erection issues and maybe Viagra's not working or testosterone's not working. This might help them along their way. This is not something you do just because your friends tell you to. It's something that's personal and private that you should discuss with your partner. Then there's also penis enlargement surgery that people are actually doing, or extender treatment. So they have fillers and PRP and traction devices that claim to increase penis size. I don't know if they do. But the injections and the fillers are sometimes used cosmetically to increase the girth, but they have potential complications. Whenever you're injecting something down there in a male anatomy, just like anywhere, you could have infections and it could enlarge it too much. When someone promises 3 inches by lunchtime, I would question their methodology because it might cause a lot of problems. But erectile dysfunction is also a signal that they may not be healthy. Their blood pressure may be high. They could have high cholesterol, which is decreasing blood flow, or blood sugar issues. Testosterone is one thing, ladies, that will help a lot of men. But if they have sleep apnea or cardiovascular issues, sometimes, improving their overall health improves their sexual function along with it. The pelvic floor therapy isn't just Kegels. There's actually a machine now that you can go and work on your pelvic floor. And sometimes they're too tight. A chronic tense pelvic floor can contribute to pain during sex. Blindly doing 500 Kegels isn't necessarily the answer. A pelvic floor physical therapist can evaluate that, and there's machines that can help with this too. Exercise is sexual medicine too. If you're having a libido issue, maybe you need more physical activity. I think a lot of people are sedentary these days, and without the physical activity, you may not be sexually turned on. Psychologically, when you feel physically capable, strong, and connected to your body, experiencing your body different, instead of thinking, what does my body look like? You begin thinking, what does my body feel like? When you enjoy your body, the sexual energy is heightened. Also, don't forget your sleep, because your sleep is so important. Your body has priorities. If it's exhausted, or your exhaustion will outrank any sexual desire you have. Sometimes your body isn't saying, I don't want sex. It's saying, I want 8 hours of sleep where nobody touches me and I can wake up in the morning. Long-term relationships have an interesting problem, though, because safety is wonderful in long-term relationships, but predictability isn't so wonderful, especially with desire. So if you're in a long-term relationship, ladies, you're probably feeling safe. You're you may feel respected, hopefully. The predictability of it may get old. So that's why you need to start spicing it up. Go somewhere else, go to a hotel room, change the environment, go on a date, wear something different, try a toy. All of these things can help. Change the time of day, send a flirtatious message at night for the morning, and then you just anticipate it. Anticipation itself can become part of the arousal. Stop scheduling sex only when you're exhausted. This one seems ridiculously obviously, but you shouldn't try to perform sex when you're tired. You spend all day working, you eat dinner, you clean, you deal with the kids, and at 11 o'clock somebody says you want to. Most women are like, nope. I'm too tired. Try to schedule it when you're both feeling better, maybe Saturday afternoons. Maybe you set a schedule, and I hate scheduling sex, but sometimes you need to. If you do it every other day or daily, you need to maybe find the best time in the day that works for both of you, where you're both rested. Couples also, they tend to make intimate interactions as an all or nothing proposition. That connection doesn't always have to follow the exact same sequence to end with intercourse. It could be you just gave somebody a massage and you left it be, or there was one of you did oral and you left it be. It doesn't have to turn into a full-on sexual intercourse. Maybe tonight, you just want to hold each other, touch, and kiss. Another night, you may want a massage that leads to something or it doesn't, or play with a toy together. Intimacy can take many different forms. Sometimes you want intercourse and sometimes you don't. When every affectionate touch automatically means you're going to have sex, sometimes that's a turnoff for people because they want to have the freedom to explore themselves and their bodies with each other. So remove the pressure, and that can actually create more desire in the relationship. And deal with the relationship outside the bedroom as well. No vibrator, hormone prescription, or injection can fix resentment. So if your partner is being disrespectful or not assisting you when need be, or doing something they shouldn't be doing, don't be surprised if your libido is not particularly enthusiastic about that person, because sexual health isn't isolated from relationship health. And just so you know, women can feel things even before they know them. If they're getting a bad vibe about something and they've told you and you're doing something you shouldn't be doing, they may know, and it will affect the performance in the bedroom. So ask yourself, do I have a low desire generally, or do I have a low desire in this relationship for this person? That is a difficult question, but it's an important one to answer because those are two completely different problems. I know when I'm not feeling safe or respected, I lose desire for my partner no matter how much I desired them before. But here's what I want you to do. I want you to stop asking whether you're as sexual as you were at 25. You're not 25 anymore, and it's okay. The goal isn't to recreate your body. It's to understand that your body, the body you have now. Learn your desire cues. Give yourself more time to become excited and aroused. Address the vaginal dryness thing, because that you have to, or it's going to create pain during sex. And if the man is having erectile issues, have him address those as well, and you can assist instead of hiding them. So if you're considering other types of O shots or P shots or fillers, talk to your doctors. That's something that is a little bit more invasive, but not completely invasive, but explore toys and devices first. And don't worry about the embarrassment. I mean, if you're in a relationship with somebody, you've been in a relationship for a while, this should be something fun you can do together. Learn your own body, exercise, sleep, flirt, and create that anticipation and that novelty. That way you don't have to, stop having fun sex together. And you shouldn't at any age, because sexuality evolves as we get older. It's funner, actually, I think. Maybe this chapter isn't about trying to get your old sex life back. Maybe it's about building a better one, because this time you actually know yourself. You know your body, your boundaries, what you like, you know who you like, and you know what you don't like. And hopefully you've reached an age where you're finally willing to tell them out loud. Because this is your midlife. You only got one life. You have one life to live. You need to be honest with your partner. I hope this helped people today. This is Diva Mia with Diva Details. I want you to feel empowered, strong, and able to take on the world. I hope that this helped you. I'll see you in the next episode. Take care.
Thanks for tuning in. Like, subscribe, and drop a comment. We'd love hearing from you. Visit thedivadetails.com to connect. See you next week for more.
Diva Details podcast and website are intended solely for informational and entertainment purposes. The content provided does not constitute professional, medical, financial, or legal advice. We are not licensed medical practitioners, financial advisors, or legal professionals. Always consult with a qualified healthcare provider for medical advice, diagnosis, or treatment. Any financial topics discussed are based on personal opinions and experience and should not be considered professional advice. The content provided does not constitute legal advice. The Diva Details and its affiliate contributors and guests are not liable for any losses or damages arising from the use of our content. The opinions expressed in the podcast are solely those of the speakers and do not necessarily reflect the views of any affiliated organization, sponsors, or partners. While facts discussed in the podcast are researched and accurate to the best of our knowledge at the time of recording, information may change over time. No guarantees are made regarding the accuracy, completeness, or reliability of any statements or opinions presented. It is the responsibility of the listener to verify any and all facts that may influence their decision. This podcast is for information and entertainment purposes only and should not be considered professional advice.